So now we're going to talk about the upper respiratory system diseases. So we start with pharyngitis, which is the same as sore throat. It's mostly caused by strep pyogenes, group A streptococcus, right? Laryngitis, which is often viral, usually caused by the common cold and the flu virus, but can also be caused by the group A strep, by Corynebacterium diphtheria, by chlamydia, and others. Staphylococcus aureus can also cause laryngitis. And then we have tonsillitis, which is the inflammation in the tonsil, the lingual and the palatine tonsils. Remember, close to the uvula, in the end of the palate, or the ones that are in the base of the tongue. And then sinusitis, which is inflammation of the sinuses, usually self-limiting, but can be caused by strep pneumoniae, Haemophilus influenza, and Moraxella catarrhalis. Epiglottitis, which is caused by Hib, Haemophilus influenza B, is very life-threatening, and it's also considered disease of the upper respiratory system. Okay? I like this graph because it shows you what are the typical microbes that you see in the sinuses infection. So you see, when you have between 8 and 10 days of secretion of sinusitis, right, of secretion in the sinuses, usually they're caused by viruses, okay? And as time progresses, if that doesn't resolve, longer periods are usually covered by aerobes like Streptococcus pneumoniae, Haemophilus influenza, Moraxella. And then later you have anaerobes, because then you have that sinus already filled with fluid. There is less oxygen present, so anaerobes thrive. So then Prevotella, Fusobacterium, and others can cause discontinuation of the sinusitis after 3 months. I thought it was an interesting timeline just to show you. So let's talk about specific diseases of the respiratory system. You have strep pharyngitis caused by group A streptococcus or Streptococcus pyogenes, right? Every time we say group A, you know you're talking about S. pyogenes. They are resistant to phagocytosis, so that makes them super pathogenic. Remember, they have the M protein in the fimbria that help them attach, streptokinases, the lyse clots, streptolysins that are cytotoxic because they rupture cells, like blood cells, white blood cells. When you have Streptococcus pharyngitis, you have a local inflammation, fever, tonsillitis, and enlarged lymph nodes. It's important to diagnose this disease mostly in children and teens, because remember how these bacteria, S. pyogenes, can get into the blood and run and go to the heart valves and cause, not just there but in joints, rheumatic fever. Okay? There is a syndrome that is characterized by a presence of a specific strain of Streptococcus pyogenes that produces an erythrogenic toxin. When that strain, which is able to produce that toxin because it got inherited by transduction from a virus, remember how viruses can bring toxins when they infect bacteria, the bacteriophages, so they can inherit from viruses erythrogenic toxin. This toxin is what causes, so this is the pharyngitis. When pharyngitis gets worsened and becomes scarlet fever, then you have this strawberry-like appearance in the tongue, okay? Scarlet fever is mild and is usually just self-limiting, and it shows as a sore throat and that strawberry-like appearance in the tongue. This rash is actually all over the body, but in the tongue it looks like a strawberry, and also poses risks of rheumatic fever if untreated. So now let's talk about diphtheria. Diphtheria is caused by Corynebacterium diphtheriae, and it is kind of a sore throat, but in this case, it forms a grayish lesion in the pharynx, okay? So this lesion is typical of the production of exotoxin. So exotoxin is produced by this bacteria that receive the toxin from a virus. That's why it's called lysogenized. And this toxin will cause this necrosis in the pharynx, okay? Because of the necrotic tissue, the bacteria can keep growing there, and then it can go to the blood. If that happens, you can have complications such as airway blockage, damage to heart muscles, myocarditis, nerve damage, loss of the ability to move, such as paralysis, and kidney failure. So you can have complications from diphtheria. That's why it's very important that every age gets vaccinated against it, okay? There's also cutaneous diphtheria, which is less common, but you can see an ulcer forming on the site of lesion. And the vaccine that prevents diphtheria is, I'm saying the name of the bacterium, which is Corynebacterium diphtheriae, but the name of the disease is diphtheria. Prevented by this vaccine that includes a diphtheria toxin, okay? So the D is for diphtheria toxin, T is for tetanus toxin, and AP is for the toxin from pertussis that we're going to talk in a minute. Symptoms of diphtheria are weakness, sore throat, mild fever, swollen glands in the neck, and the vaccine is administered in kids at 2, 4, and 6 months, and another dose between 15 and 18 months, and another dose from between 4 years and 6 months. You also need a dose in preteens, 11 to 12 years, and then for adults every 10 days. They should have either TD or Tdap, okay? The name of the vaccines change because the doses are different, but they are all composed of the same toxin. So this is all toxoid vaccine, right? Inactivated toxin. So that makes these vaccines not conferring often lung protection, right? So because they don't cause lung protection, you need boosters all the time. Okay, so now let's talk about otitis media. So that's the inflammation in the middle ear that I was trying to draw for you. So this, let me get my pen again. This is the external ear, right? External ear is here. The middle ear is from here to here. So all this is middle ear. And what happens in middle ear is that the fluid that can come from the nose, from the nasal cavity, accumulates here because this is enclosed, right? The only place where bacteria can get into, if the membrane, the tympanic membrane is intact, is through the nose. So if you look at the difference between a kid and an adult, you can see that the eustachian tube is more horizontal in the kid when you compare with the adult. So it's easier for kids' nasal secretion to get into the middle ear, okay, due to this horizontal position of the tube. So it's important that otitis media is treated with antibiotics. The causes can be strep pneumoniae, Haemophilus influenza, Moraxella catarrhalis, and Streptococcus pyogenes. Also, the RSV that we're going to talk about, and common cold and flu viruses can cause otitis media. So multiple different etiological agents can cause it. There is pain in the ear, that's the main symptom, and that pressure makes the eardrum bulge, and you can see that through the use of an otoscope. Prevented by vaccine, so if you use, for example, the Hib vaccine here for meningitis, you're preventing also the otitis media. If you use the vaccine against the pneumococcal, you can also prevent otitis media. but there's still room for some other microbes to cause it, right? So it doesn't mean the kid is never going to get it because he got these 2 vaccines. They can still get other types of pathogens. If you breastfeed the baby exclusively until the baby's 6 months and continue to breastfeed for at least 12 months, that gives a lot of antibody for the baby and protects against this type of infections. If you don't smoke and avoid exposure to secondhand smoke, that is also a way to prevent it. And dry ears thoroughly after swimming. Common cold. So this is the last disease of the upper respiratory system. So symptoms of common cold are what we know: sneezing, stuffy nose, runny nose, sore throat, coughing, mucus dripping down the throat, watery eyes, fever sometimes. It's not necessarily accompanied by fever, okay? Over 200 different viruses can cause common cold. The rhinovirus is the most preeminent one, but also coronaviruses and one specific type of enterovirus can cause common cold, okay? There is no vaccine for common cold, and it's usually self-limiting. There's not very typical complications also. Symptoms can last from 10 to 14 days, but they usually improve over time. Okay, guys, let's see this case here. Patient presents with fever, red sore throat, later a grayish membrane. Which type of microbe that is gram-positive and a rod that forms a grayish membrane could we be talking about here? So go back to your notes, to what we just talked about. Have a look at this table and see which one is the microbe that is causing this disease, okay? If you have questions, please ask me. I will see you in the next video. Bye.